myths versus facts. That's what we do every week on Tear Up with Dr. G. And we're kind of already kind of leading into that kind of is this true, but I wanted to kind of make sure we stay consistent with what we do. So again, a lot of misinformation out there. Let's tell the truth. So I may participate in this as well.
Sure.
I like it. I like
Sounds
how this is like the most I participated in
really?
fact and fiction ever on any show of Tear Up with Dr. G because it's you. That's why I did it on purpose. All right, let's do this. Tear Up with Dr. G. Here we go. Myths versus facts. Rheumatologic conditions made ridiculously simple. Here we go. I'll say the statement, and then Dr. Dsilva will say myth or fact, and tell us why. We'll do a boom, 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 boom. Kind of go through this. Here we go.
Okay.
All right. The symptoms of rheumatologic disease can be difficult to pinpoint and are often dismissed as just aches and pains. Myth or fact?
Fact, 100%
Please explain.
fact. So a lot of these symptoms can overlap with one another, and that's why it can be very difficult to pinpoint a true diagnosis. That's where blood tests can be helpful, but again, blood tests are not 100% accurate, and so it can be difficult. A lot of times, even like we said, even having a cold or a flu, you're going to have diffuse aches and pains, and you might feel like that. Like you mentioned, having more prolonged symptoms lasting more than 6 to 8 weeks, even 3 months, that's when we worry about something more going on.
Excellent. Here we go. I'm going to do this one, myths versus fact. Here's the statement. Rheumatologic disease is just another name for arthritis, and that is certainly a myth. The reality is that there are over 100 different types of rheumatologic conditions affecting over 50 million people in the U.S., so it's very diverse. It's not just arthritis, and that's one of the biggest myths out there. It's so much more than that, but again, get back to if something's going on, I want you to go see your doctor and have a proper assessment and evaluation. So here we go. Here we go. Myths versus facts. I like this one. Dr. Dsilva, this is for you. Rheumatologic diseases only affect the elderly.
Myth. So like we touched base on already, children can get it, particularly younger women as well as men. These autoimmune conditions don't really have any particular age. I mean, there are some associated ages and bimodal curves and whatnot where there's more frequency, but it really can affect you at any age.
Excellent. All right, here we go. I like this one. I'm giving myself these easy ones, and Dr. Dsilva's getting the hard ones. Sorry, that's how it works. It's all good. It's like your cable my show. It's all good. Here we go. Here's a statement. Treating rheumatologic diseases is not a one-size-fits-all approach, and I think Dr. Dsilva will agree with me. It is true. It's not a one-size-fits-all approach. With anything that we do in health, we certainly want to make it as tailored to the person. We want to be realistic with people, too. We want to find out what their goals are when we render them a diagnosis, but we also want to plan ahead. We want to, I know I certainly try to take the time to explain the condition to my patients in plain terms and talk about what's realistic. And I know if somebody's got a pretty progressive rheumatologic disease, again, of course, we're seeing you, but even when they come back and see me and I just kind of talk about lifestyle, but it can be so unique on the person. So we have to be there. All right, here we go, Dr. Dsilva, I like this one. Here's a statement. Women and minorities are disproportionately affected with rheumatologic disease. We didn't talk about a little bit of a ethnicity breakdown.
Right. So I was going to say fact-ish. Again,
fact-ish, okay.
That's
fine. Please, go right ahead.
So there are certain diseases that seem to be more prominent in certain ethnicities. And again, whether that's a genetic background, it's hard to say. And it does seem like women in general do suffer from particularly rheumatoid arthritis as well as lupus more often than men.
Okay, thank you. Here we go. I'm going to take this one. Rheumatologic disease will go away with time. And I'll kind of say depends, and I'm only going to say it depends on the asterisk next to it. If I have a bum hip and I finally get surgery and I got a new hip, I'm feeling pretty good. I don't have any hip pain anymore. But if we're thinking about more the context of things like lupus, yes, lupus is not curable. Rheumatoid arthritis, you're going to be on something, you're going to be in a big game plan. Most people with gout are taking something pharmacologically in addition to the lifestyle. So think of it as more of a lifelong, generally speaking. But if you have a bum knee from osteoarthritic breakdown and you get that new knee, you do your proper rehab.
But keep in mind, if you have a bum knee or a bum hip and you wait too long, that's going to affect other joints in your body. Because remember, you are one body, right? So right hip pain, if you have really bad arthritis, the way you're going to be walking to compensate for that pain is going to cause issues on the other side. So that's my only little caveat.
I love it, Dr. Dsilva. I love it. Here we go. We'll do a couple more of these. I like this one. This is an easy one. I love this one. I wrote this one for you on purpose again. I wrote a lot of this stuff for you. Here we go. Here we go. Here's a statement. Your primary care physician will refer you to a rheumatologist if your symptoms indicate a rheumatologic disease. Myth or fact?
I would like to say fact, but there are some situations, again, like we talked about, that some rheumatologic diseases can be managed by the primary care. So I don't want to say always a rheumatologist. And like we talked about, there are other specialties that can be involved, particularly orthopedics, podiatry, and depending on what true rheumatologic disease, we might be even talking about cardiology, like a lung doctor, a kidney doctor, a heart doctor, all of these other things. But again, if you don't mention to your primary care provider what is going on, then it'll be hard for them to kind of get you on the right path and get you to seeing who you need to see.
Excellent. We'll do 2 more of these. I'll take one. I'll have Dr. Dsilva take one. I might go out of order, but here we go.
Sure.
The FDA is currently unable to regulate the quality of herbal remedies and supplements, or to verify their effectiveness or safety. And that is true. There's a lot of difficulty in doing that. The reality is that for a lot of different non-pharmacologic options, certainly like the herbal remedies or the supplements that are out there, the reality is just that clinical trials are lacking. There may be some in vitro anti-inflammatory benefits, but the reality is just we just don't have the data. And this is where I think you have to talk to your physician to find out how you can best approach a rheumatologic condition.
And just a quick
Please,
thing,
go ahead.
so the NIH actually has information on some of the supplements
Okay.
and some of the things that are somewhat controlled. So
That's
if you
good
have
resource.
questions, that's a resource for patients
Excellent.
to
She
look
said
at.
the NIH, National Institutes of Health. Thank you, Dr. Dsilva. Here we go. The last one, myths versus facts. I like this one. Here we go. I like this. Here you go. Arthritis is an inevitable part of life, so you just have to deal with it.
False, or myth, I should say.
Please explain.
So yes, to a certain extent, by the time we all reach a certain age, we might have some level of arthritis, but we have such control in our lives to try to slow that progression, particularly if you're talking about that wear and tear arthritis or osteoarthritis, by the lifestyle modification. So making sure that we're not obese and that we're controlling our weight. Studies show that 1 pound of being overweight is actually 4 pounds of pressure on your joints. So those are things that you can actively try to change in your life to try to prevent it. And it's not something you just have to deal with. Obviously, we've talked about multiple different treatment modalities, whether it's physical therapy. We didn't get to talk as much about that, but physical therapy, staying active in conjunction with medications to try to help.
Wonderful. So there you go, myth versus facts. So we have just a few